dramatic reason for blindness is cataract worldwide, where elderly people are the most affected population. The prevalence varies. In United Kingdom is 30% of the elderly above 65 years of old, while in Myanmar is around 40%. This both done in two different studies conducted in 2008 and 2009. Limited and expensive healthcare facilities make elderly and low and middle income countries more vulnerable to this phenomenon. As a representative of this particular region, Bangladesh is not an exception. Cataract does not only affect the patient lifestyle, but it also negatively impact their family and loved ones, and thus affect the society as a whole. This study was aimed to determine the causes, ratio of cataract in Bangladesh. The result will help plan a better program to avoid its consequences. The methodology. Well, this study utilized a descriptive cross-sectional study design focusing on a real-world sample on the elderly patient attending the rural eye camps. A total of 1,020 participants were selected from 2 eye camps in 2 districts in Bangladesh. Then a certified ophthalmologist ensured accurate diagnosis of cataract, qualifying the participant for the surgical intervention. With participant permission, demographical, occupation, and health history data were collected through a structural face-to-face interview. That was validated under epidemiological oversight, ensuring methodological rigor and credibility of the findings. The result was the distribution of the patient according to their perception of the occurrence of the cataract disease. This word was used from the patient point of view. So we give aging as our highest participants, with a total of 437. Among most of them were males. Few of them said we don't know, around 265. Some of them said it's a genetic, which is more than 101, and God gifted, which was actually supposed to go under genetics, but as they say, it's a God gifted when you wrote it like that. Injured by chemical, and quarreling also was there as well, of 42 people. The duration of suffering from cataract in years. Most of them had 1 to 3 years was had the highest duration of 318 participant male and 200 female, and less than 1 year was 138 and 76, and few of them even delayed the treatment up to 12 years. The reason for taking this long for the treatment, financial inability was the highest with 402 participants, and the remaining was sequelae and awareness, and then no doctor around, 191, and then there is no severe complication according to them, and long distance was 41 of the participants. The response to the reason behind the cataract during the suffering from it, here just we're demonstrating that the p-value is below 0.25, including its reliability. So the conclusion. It is concluded that there are more males than females among cataract surgery patients in Bangladesh. Working class of 15 to 64 and illiterate are more prone to suffer from this condition. Most participants had no family history of cataract, and many attributed to aging. Most patients delayed the treatment for 1 year up to 2 years. Financial instability was identified as the primary reason for the most of the participants of this study. It is noticed that age was significantly associated with the diagnosis of cataract and delaying treatment of the disease. So cataract in Bangladesh is a growing issue. There is actually a number of the registered ophthalmologists under BMDC, Bangladesh Medical and Dental Council, is around 1,200, and overall with unregistered one is 1,600 ophthalmologists, was due to a research published with Orbis International. It is officially estimated that approximately 1,200 new patient, 120,000 patient develop cataract every year in Bangladesh. With this particular issue, if we say 1,600 serving 170 million, that is around 106,000 people are for each ophthalmologist. And approximately the fighting we are doing it is around 70,000 cataract surgeries were performed in Bangladesh in 2024. This is a Sight Saver USA for cataract surgery. These are my references. Thank you all.
Yeah, thank you.
Thank you so much.
I have a few questions. The first
Please.
question is, what is the economic level of these patients? Because it may differ in your country.
Yes.
You might have people at the upper economic level, mid, and the lower. Because the awareness will be different in the three, and your data may skew.
Well, basically, as you know, these camps were attended completely free for the most rural areas. Okay, if we had to go to the most rural, and that's why I categorize it into two: lower and lower economic status. Because maximum of their income, when I asked them the question, it was around like 5,000 and some of them 1,000 BDT. That you are talking about less than $10 US. So when we talk like that, it's I have categorized only lower and below the lower because they are in the most like in the survival period, you can say.
So, in your conclusion,
Yes.
because this data is important,
Yes.
in the public health interest,
Yes.
and that is why these kinds of data are used to create public health policies, actually.
I agree.
And what is the public health importance for you did the study to transfer to your government?
Well, actually, its importance one is to understand the consequences and to the delay of the treatment, and that was my basic goal to identify actually why they are not actually taking the initiative. Because every time I go to a camp, what I see is all are hyper mature. You're talking it's like a grade 4. Some of them have gone to Morgangian. So to identify what is the reason of delay the treatment, I categorize it in this way, and even I published it in the Saudi Journal of Medicine, and I have submitted to few index journals in Bangladesh only to identify about its importance and the gaps within it.
Okay, good.
Can he ask a question?
Yeah. So, Dr. Salman, a beautiful presentation. So, just for my understanding, so Al Basar Foundation, this is not a Bangladeshi, right?
No, it's actually a Saudi NGO, and it runs in 42
also-
countries.
it's
It's a Saudi international NGO.
Saudi,
Yes.
okay.
Our head office is in UK, and we run in like 42 countries, but Bangladesh sector is run by like us, basically.
Right. Again, and I think it's very important work, but just my understanding is, I mean, it's unfortunately, it seems in Bangladesh, the healthcare service is not good. They're not accessing treatment. But what's your point of focusing? I mean, it's obvious that there's no access to treatment. There's like difficulty access to treatment.
Actually, I understand your
Right.
point. What we are trying to, we have already established 10 hospitals in 2 different areas just to fight cataract, basically. I'm not telling it's a super specialty hospitals. But in Dhaka, definitely in the capital, we have a super specialty hospital with all the subspecialties. But in the rural area, cataract is the major reason. Definitely, we get few cases for trauma in which we refer them to our like head office. But due to less access, we have made a few big hospitals in the peripheries and few also small clinic, more than 11 other small clinics specifically for cataract, because it's our main concern. The people come with a severe complication, even they develop glaucoma and some other factor only because of cataract. That is how we are trying to fight it in Bangladesh due to less access. Please.
Yes, just also about El Basar. El Basar Foundation, this is the same foundation that is in North Africa, yes?
Yes, definitely, yes.
It is the
It's
same,
the same,
the same
the
one.
same,
Okay,
yes,
okay,
yes, yes.
thank you.
Yeah.
He's from Yemen, but this foundation is all is in North Africa and some of the
it's
areas
done,
in
it's
Africa.
in some other African country.
Yeah,
and
the
it
same
is
foundation.
In also, it was previously in India as well, but later on now we are not there anymore.
Yes, because El Basar Foundation is one of the is doing a great job since years and years in Africa and everywhere. So this is why I'm asking, because it's. Thank you.
No, even I have mentioned there. You see, in our if you can let me access, we have done almost more than 6 million people have received free treatment in Bangladesh only, and 300,000 plus people have got a cataract surgery completely free of cost. Just
It's very well presented, and I
Thank
must
you.
say that it just highlights the fact that on one end we are talking about genetics in glaucoma and genetics in ophthalmology and biomarkers, and on the other hand we still have people who think that the cataract is a God's gift. So it's important to keep us grounded as ophthalmologists also and highlight the kind of work that you're doing.
Definitely.
So
Thank
very
you so
well
much.
done.
Thank you so much. Appreciate it. Thank you, everyone. Hello. Thank you so much.
I think you need to increase ophthalmologists. There are only 1,200 for some billion people. Bangladesh.
170 million.
Oh, 170 is too much for 1,200 ophthalmologists. Yeah, and it's cramped in a small place. May I request Dr. Sanal Oshirov to present?